Hey, everybody, it's Devin.
And Kate.
We're back.
Woo!
Welcome to Med Crimes.
Headlines XL Part 2.
Dude,
Dude,
I had such a great vacation.
the best vacation ever. And it was only 2 minutes. 2-minute vacation.
The thing is this episode's coming out after our bestie vacation with our families. However, this episode is being recorded only about 5 minutes after part 1.
Mm-hmm.
So we're just dreaming of this vacation.
That is around the corner.
That was a big hole in the ground that we saw.
Yeah.
That was a big hole in the ground.
Can you guys guess where we're going? We'll post about it. That was a whole big old crack.
That was a big old crack in the ground.
Oh,
So therefore, we do not have any new Patreons
we
this
don't.
week.
Nope.
Because no time has passed.
So if you signed up in the last couple of weeks, we'll get you next time.
You will get on the next time.
I promise.
And I am happy to say that coming before the next episode is the Patreon special.
Woo woo!
So this is your last warning.
Woohoo!
If you want to hear the Patreon only, hop on over to patreon.com.
Yeah, buddy. All right. We got part 2 of Headlines XL Special Edition on Dr. Thomas Shaknovsky and the 1000% preventable death of Mr. William Bryan.
I want to know everything.
You are going to know all the things that I know in a minute.
I know the difference between left and right.
I know that most of us know the difference between left and right, except for apparently this surgeon. Allegedly.
Good clarification.
Yes. So, we are going to pick up where we left off. Go listen to part 1 if you haven't yet, because the whole intro to the story and a little bit of the background and some A&P is in there as well to kind of talk about, the little bits and pieces.
How do I get, because I'm just stealing your phone.
Boob.
Well, I knew that, but I haven't gotten there yet, first of all.
Okay.
I don't know why.
If you swipe up,
I hate iPhones.
No, you don't. You just don't know how to use them.
I hate iPhones.
Swipe up. Oh, you found it. Okay.
Where's the do you have a Patreon app?
I do. It's black and white. You just got to swipe screens until you find it. There's like pages and pages of apps because I'm crazy.
And there's your shit.
No, it's perfectly organized according to me.
No, not
Yes.
really.
Uh-huh.
Okay, go ahead.
Okay. So we talk a little bit about like the difference between the liver and spleen, why you can live without one and not at all live without a liver. Not having a liver is completely incompatible with life. And unfortunately, what happened was this gentleman ended up with this anomaly on his spleen that was seen on some imaging. He was having some left-sided abdominal pain. After 3 days of trying to pursue him to go into surgery, he finally relented and went into surgery with Dr. Thomas Shaknovsky, who had had sort of a reputation for some questionable outcomes. There were some settled out of court situations about some real big surgical fuck-ups, which we talk about in the first half. And unfortunately, what transpired in the operating room is all alleged because is wild. So we have some witness statements. We have interviews with staff. There are several staff members that are also named in this lawsuit, as well as the medical system itself for continuing to employ this physician who had had negative outcomes, and for, essentially allowing this guy to continue to practice medicine within their systems.
I'm not okay.
I know.
I still can't. I can't get from A to B without understanding.
Yeah. I mean, anybody who's ever taken just a single anatomy and physiology class would know this quote unquote surgery had just occurred. It started out laparoscopic. They then converted to open because when he put the camera in there, he saw that his very inflamed bowel was kind of obstructing views. So they converted to open. The bowel was huge and distended, and it was obstructing partially the surgical field of view. So it was hard for the other people in the room to see exactly what was going on. But the specimen that came off of the field just before Mr. Bryan coded and died looked suspiciously like a liver to everybody in the room. And once this poor gentleman had passed away, sort of the higher-ups in the room in the hospital start to gather in OR number 3 at Ascension Hospital to try and figure out what happened here. And they all are looking at this specimen thinking, boy, that looks like a liver. And the physician head of surgery was looking, and the head of the medical staff was looking at the specimen and immediately knew it was a liver. Okay. So Now, I'm again going to start reading little snippets from the court documents because that's giving us a picture of like the actual, cascade of events within the OR. So, Mr. Bryan was pronounced dead in the OR at 6:56 p.m. on August 21st, 2024. And in Information and Belief, defendant Shaknovsky instructed the circulating nurse, Nurse Nelson, to label the specimen as spleen, and he put it in the bucket and get it to pathology. And on Information and Belief, defendant Nurse Nelson knew that the specimen was not the spleen. She knew at the time that it was a liver, but she inaccurately labeled it anyway because she was instructed to do so. Defendant Shaknovsky continued to try and convince the operating room staff that the removed organ was the spleen, and at least one member of the surgical team became physically ill after hearing him continue to state that this was the spleen.
Physically ill?
Physically
like he
ill.
Vomited while listening to this?
All it says is he became physically ill. So that is my assumption, but I'm not sure. Continuing, defendant Shaknovsky returned to operating room 3 on 3 separate occasions following Mr. Bryan's death in an effort to convince all involved that he removed the spleen and that the death was caused by a splenic artery rupture. That is his official diagnosis and the official cause of death according to him. And on Information and Belief, the CMO, Chief Medical Officer, contacted the on-call pathologist via cell phone, and at or around 6:59 p.m., the supervising anesthesiologist and the chief medical officer of the facility all exited the operating room and conferred with Dr. Shaknovsky, with the night shift house supervisor near the surgical control station. And just after talking in a group, Shaknovsky then leaves and he goes and visits the medical library. And we know this because he scanned his badge to get into the medical library.
So it tracked his,
Exactly.
Yeah.
So he did this in order to do medical research for his operative report that was deceptive and fictional. That is a direct quote from the court papers. Badge swipe history reflects defendant Shaknovsky then accessing the medical library again at 7:18 p.m. And the accounts of his surgery from personnel in the room are in direct contradiction to the operative report dictated and signed by defendant Shaknovsky. So, everything he said in his op note, everybody that was in the room is like, no, that is not what happened. That is not how that happened. And this is very different. So, when they broke the news to Bill's wife that he had coded in the OR, their explanation to her was that he had a hemorrhage due to a splenic artery rupture.
That poor woman,
I know.
by the way.
And, at first...
Wait a minute, so they lied to her?
Well, so his diagnosis in the immediate aftermath was a splenic artery rupture. So they initially had not... everybody had suspicions, but they had initially not confirmed that it was a liver and not a spleen, evidently. But very soon after the conversation, very soon after she found out, they knew that the liver was removed. And they dragged their feet notifying her and did everything in their power to not disclose that information. So, allegedly. So, in the hours following the surgery, Dr. Shaknovsky sent several texts to Bill's wife, all very sort of apologetic, invoking religion, stating we're all so heartbroken, he's in a better place now, he's with God, obviously trying to sort of placate the situation and appear really sympathetic to sort of feel things out, right? Which is pretty gross. On August 22nd, 2024, the surgical pathology specimen is documented as being received with gross evaluation noted as the following, quote, received in formalin, labeled with the patient's name and, quote, spleen, is a grossly identifiable 6-gram liver, measuring 23 by 18 by 11 centimeters. The capsule of the liver is partially torn. The hepatic veins are left open. The specimen is serially sectioned, revealing no gross identifiable lesions or masses.
So essentially, they can't find a reason why it was taken out?
There was nothing on the surface that said that this organ was even diseased. So, that wouldn't have been a reason for him to mistake it for the spleen. You know what I mean? So, there was nothing that said that the liver was a problem at all. Representative sections submitted in 10 cassettes as follows. They were all sections of healthy liver parenchyma. On August 23rd of 2024, the surgical pathology final report was finalized, including the following diagnosis and commentary. Quote, tissue designated spleen, excision, liver. So the tissue was designated as spleen, but the excision was a liver.
This was his report?
This was the pathologist's report,
yeah,
the pathologist that was looking. Yeah. Liver with mild chronic portal inflammation, no malignancy identified, no splenic tissue identified. There was no spleen in that bucket.
Like that was not a spleen.
That was not a spleen, sir. And this was by the pathologist, Dr. Blanchard, reporting these findings. And Dr. Blanchard actually directly reported his findings to Dr. Shaknovsky on August 23rd, 2024. So he said, sir, what you sent me was a liver. That was not a spleen.
What did the operating report from the surgeon say?
We'll talk about it. I got that too. Don't worry.
Based on your face, you're
Wait,
like,
I got that too.
You've covered all of my questions.
Just so good at the covering.
You did great.
I'm so good at the coverage. The covering. So on August 23rd, 2024, same day, after speaking with Dr. Blanchard, the pathologist, who told him, sir, that was a liver that you sent me, defendant Shaknovsky certified the Florida death facts attestation as followed. So he certified his death record, his death certificate, saying manner of death, natural, cause of death, hypovolemic shock, hemorrhagic shock, splenic hemorrhage. He knew that he took a liver out at this point. He knew this. There was documented proof.
He was still blaming the mild bleeding.
And he said this was a spleen hemorrhage. This man,
Had
the fact that
nothing to do with the full hepaticectomy that didn't need to happen.
The fact that I removed this man's liver is irrelevant. He died of a splenic artery aneurysm.
I'm going to assume that the medical examiner disagreed with that statement.
A lot.
Yeah.
Yeah. Between August 21st and August 26th of 2024, no one at Ascension Hospital provided the true cause of Mr. Bryan's death to his family or the Florida District 1 medical examiner.
That poor woman.
I know. On information and belief, defendant Ascension's risk manager, Derek Merrill, so this is the guy in risk management who's involved because of this huge mishap, was working hard not to disclose the real truth. This is a direct quote from the court documents. At one point, his office refuses to cooperate with the Florida District 1 medical examiner's office when they asked for Mr. Bryan's liver. The medical examiner was like, can we have the liver, please, so that we can look into this? And he was like, no. Made it really hard for them. No,
you may not.
All alleged. And then between August 25th and 26th, Florida District 1's medical examiner was notified of the surgical pathology report findings, after which the medical examiner's office took jurisdiction of the matter. And they said, okay, now that we have the official report that was a liver that was removed, like, we are opening a full-ass investigation about this. Like, no more bullshit, you guys. You have to give us what we need.
Finally.
Autopsy findings per the Florida District 1 medical examiner's office include the following. Are you ready?
A different cause of death.
Maybe a little bit.
But hold on. I'm ready.
Okay. Quote, surgically absent liver. No evidence of vessel cross-clamping or ligation or cautery. Overt dissection of the inferior vena cava.
Okay, so hold on. So regardless if there was a need for the liver to be taken out, he still didn't do it the right way.
Right.
Because he was just chopping and cutting through open blood vessels.
Yes.
Okay. And
so,
what did you say about the vena cava?
Overt dissection of the inferior vena cava.
So he cut it.
He cut it or ripped it. Yes. And an untouched spleen without aneurysm or rupture. So let's break this down. So they found that that the liver was just gone, that all of the vessels, so that it is not easy to remove a liver. Okay, this is not an easy thing.
You don't do it.
There are so many anatomical landmarks that you just have to ignore, first of all, to remove a liver instead of a different organ. You have to dissect it off of the surface of the diaphragm. You have to clamp and cut all of these vessels in order to control the bleeding. But on the autopsy, there was no evidence that anything was clamped or ligated and tied off to control bleeding. Everything was just cut, and then he just hemorrhaged into his cavity and died immediately. Not to mention the fact that the inferior vena cava was dissected, which means it was torn or cut, which is one of the biggest blood vessels in your entire body, if not the biggest blood vessel. It's a giant vessel that runs from your groin all the way up through your abdomen and chest. And it is a big vessel, and if anything happens to that vessel, it's catastrophic.
Yes, correct.
So I mean, this is so alarming. This is so alarming.
I mean, so let's just say he took out the spleen, right? Which he didn't.
Right.
But let's just say he did. The techniques that he's using that he took out the liver with, complete sloppy.
Precisely.
It's sloppy.
Because
so
you're not
mistakes
clamping.
all over the place.
And we're going to get into it, but he never asked the surgical techs for clamps, for ligatures, ligation things at all. What he asked for was a surgical stapler, which is not the stapler that puts little metal staples to close a wound. It's a device that sort of looks like, like a Nerf gun, but it has like a load and it has a staple load. And they're often used to ligate blood vessels or very vascular tissue. And it kind of like burns and then seals off and cauterizes both edges and creates like a bifurcation, if that makes sense.
Mm-hmm.
A lot of times used for like bowel, like if you're cutting bowel and then you have to reattach, like they'll use that stapler to kind of cut it, but also cauterize. So he was asking for that, which this is not the best scenario to use a tool like that, apparently. So again, this is all alleged, but that one bit for the medical examiner's office, that is a fact. Now, going on to continue quoting from the court documents. On information and belief, defendant Shaknovsky continued employment at the defendant's practice, meaning the hospital system's practice, and continued to perform surgical procedures at a different area hospital, like within their network, through at least August 28th of 2024. Finally, on August 30th, Dr. Shaknovsky's hospital privileges at Ascension were revoked. So
yeah, but that took a whole week.
It took a whole last week, but they did do it. Took a week, but they did it. Ascension's medical records for Mr. Bryan still state to this day that he died from a splenic artery aneurysm because they've never been updated.
That's not true.
Nope, that's allegedly not true. September 17th of 2024, Associate Medical Examiner Lorraine Lopez Morel of Florida District 1 Medical Examiner's Office certified the Florida death record following the autopsy as follows. The manner of death, homicide.
Whoa.
Well, it sounds like a very inflammatory word. It's used because it was not a natural death. And
okay.
and it's not undetermined because they can see it. It wasn't an accident.
Right.
It wasn't undetermined and it wasn't natural. So that
fine. So it's like
because it was caused by another person. Mm-hmm. No, he did not, stab the guy to death or shoot him in the head or anything like that. It was not like a genuine.
All right,
homicide.
I take back my woe.
I know but it sounds.
I reduced my woe.
Well, there's no need to reduce it because at the end of the day, it kind of is like this guy was murdered, like genuinely.
Yeah, he was medically.
The cause of death, exsanguination from surgical removal of the liver. Exsanguination, which is a technical term for bleeding to death.
Okay.
Exsanguination.
Jesus.
Yep. October 22nd, the Florida Medical Board issues a suspension of his medical license pending an investigation. And then the following day, on the 23rd of October, the state of Alabama, he had a medical license there as well, and they issued a suspension pending a review for that state as well. And he then, shortly after those investigations were open, he actually voluntarily surrendered. On September 10th of 2024, due to complaints, an unannounced survey was performed at the hospital, which often happens if there's like a big sentinel event. The state will come in with their surveyors and do just a whole review of everything that happened as an outside party, right?
For sure.
So this happened here, which is totally appropriate. And here are some of the findings from that. Quote, the statute or rule is not met as evidenced by, based on operating room staff interviews, interview with the county medical examiner, interview with the pathologist, and clinical record review, the hospital failed to ensure operative report were complete and accurately written for one of 6 patients sampled, which is patient number 1, which is referring to Mr. Bryan. During review of this patient's operative report from August 2024, there were several discrepancies noted when compared to the pathology report, interviews with staff. Everything he said in his operative report is like big time BS, according to everybody that was in the room. In August 2024, during a scheduled splenectomy, Surgeon A, meaning Dr. Shaknovsky, mistakenly removed patient number 1's liver instead of the spleen. The operative report documents that the spleen was removed. The operative report failed to mention that the patient's abdominal distension. The operative report didn't even mention that megacolon issue. Didn't mention it at all, which is like a big
It's a big deal.
it is a big deal. It's a huge clinical finding, and
It's part of why you opened
it's
up.
why you converted to an open procedure.
Correct.
That should be all over the operative report. So it failed to mention that. It failed to mention the presence of a megacolon, and it failed to mention the removal of the liver, of course, because what he said was that he removed a spleen. That's all he described, the removal of the spleen.
Excuse me, sir. That is false.
That is false. Additionally, the operative report contradicts portions of staff interviews regarding clamp usage, the sequence of events, and the timing of the hemorrhage or severe bleeding and the cause of death. Because in the report, he refers to clamping things and ligating things, and the surgical techs are like, I tried to offer him clamps and he didn't take them.
It's like he's just writing this operative report from like
it's a dot
a
phrase.
book.
It's a
Like,
dot
yeah,
phrase.
like
It's
just,
literally like a copy and paste dot
Right,
phrase
correct.
of a splenectomy, a
Right.
normal splenectomy.
right.
So we actually have a bit of his op note here that I am going to read.
Oh boy.
So the pathology tissue requested. So this is part of his operative note. Quote, significant hemoperitoneum or blood in the abdomen was noted. Extensive adhesions were noted around the majority of the spleen. And adhesions are when scar tissue hooks to the organ in question and pulls it and attaches it sort of to the wall of the abdomen. So it's just something that you have to go in and like kind of take down that scar tissue. So extensive adhesions were noted around the majority of the spleen. The spleen was noted to be quite enlarged. It's because you're looking at a liver. It's because you're looking at a liver and not a spleen. So, Surgeon A indicated using wound retractors placed into the fascial defect. Appropriate positioning was achieved, and, quote, at this point, using hand assist technique, adhesions on the anterior surface of the spleen were carefully taken down, utilizing laparoscopic hand assist technique. The entire spleen was exposed, noted to be severely deformed.
It's a liver.
Hemoperitoneum was noted, but no active hemorrhage or no active bleeding was appreciated at the time.
Because you weren't at the spleen.
Splenic laceration was appreciated at the inferior pole. No, it was not, because you sent a whole ass intact liver that was not nothing. There was nothing. Splenic laceration appreciated at the inferior pole. No active bleeding noted at this time. Large size of the spleen. Due to the large size of the spleen, we elected to convert to an open procedure. Which, that's not the only reason.
You were at the liver.
You were at the liver. The surgeon then made a, quote, epigastric midline incision, entering the abdomen, and documented, quote, spleen noted to be quite friable, and certainly the large size made the dissection challenging. Spleen was mobilized medially to expose the retroperitoneal attachments. The splenorenal and splenophrenic ligaments were carefully taken down. No, you were taking down liver ligaments, sir. And ligated with energy device, which is that stapler we talked about. Spleen was circumferentially dissected free from surrounding structures and was very mobile. At this time, attention was turned to the splenic hilum. Splenic artery and vein were carefully dissected out of the surrounding tissue.
Wrong.
He was
You were
working
nowhere
on
near-
the whole different side. You were looking at a portal vein and a hepatic artery, sir. This is so bad.
Great. It's
I
terrible.
cannot get over how
It's
bad
terrible.
this is so bad. So, splenic artery aneurysm was appreciated at the hilum. No, it was not. There was never an aneurysm. That is a lie.
All of this is fake news.
Allegedly.
Sorry.
No, I'm saying
with
shit
you.
too. Allegedly. Splenic artery aneurysm was appreciated at the hilum. The plan was to perform ligation of the splenic artery first and subsequently the splenic vein. Plan to perform ligation of the splenic artery close to the spleen at the hilum proximal to the aneurysm. Just prior to achieving control of the splenic artery with endogia,
I
which
love
is
how
the
it
brand
says
name.
Plan, but it's like
I
that
know.
you didn't do your plan.
I know. Now, just prior to achieving control of the splenic artery with the endogia, which is that stapling device, extensive intra-abdominal blood loss was sustained, severely precluding visualization of key anatomical structures at the hilum. Sponges gradually removed from left upper quadrant with great difficulty during ongoing bleeding. Was able to control the ruptured aneurysm with surgical clamp and then gain definitive control with endogia stapling device, vascular load 60 millimeter. Next, the splenic vein was ligated also with an endo-GIA stapling device. Spleen was removed and passed off the field for pathology.
Nope.
The word liver never appeared in his operative report. The report also did not mention the abdominal distension, severe megacolon.
I'm having a hard time trying to determine how because so your operative report is after the surgery.
Mm.
So the guy already died. It's already been like, that's a liver, and he's still writing this report as if this is a perfect splenectomy. A is not connecting to B, and I'm really having a hard time. I mean, I get it. Who wants to like write a report of like, I mistakenly thought this was the spleen and it was the liver?
Literally no
Like,
one.
you don't want to
Because
put
it
that in a
shouldn't happen.
report, but like, I just don't understand. Is this like disassociative? You know what I mean?
know.
Like, it's
Mhm.
just like, I don't.
Think-
Ow. What?
I think a lot of it was probably panic, right? That, man, this is the biggest fuck up of all the fuck ups that I've fucked up. You know what I mean? Even if the surgeon existed with this level of incompetency, the other people in the room who testified that they recognized that he was working in the wrong area of the body. And while they couldn't see very well, they knew that something was wrong, and nobody stopped the procedure, right? Allegedly. Collective sigh. Now, I'm still sort of extrapolating from the reports here. Quote, a review of the surgical pathology report dated 8/23/24 found the comment, quote, no splenic tissue identified, case discussed with surgeon. And it literally said case was discussed with Dr. Shaknovsky, and the report, it was included in that result report. And it designated the tissue as liver with mild chronic portal inflammation. And on September 10th of 2024, an interview was conducted with the pathologist, and he stated the whole organ was received in a specimen bucket labeled as spleen. However, he did not see the specimen. He did not see the specimen-only photos. He received about 8 to 10 slides to review. And he said he was able to diagnose it within a millisecond. And he said that it was, quote, pretty obvious it was the liver. He knew it immediately. There was a little question about the portal inflammation, but otherwise the liver was, it was a little on the heavy side. It was a little enlarged on the upper limits of normal. The normal liver weighs around 1,800 grams, and this one was about 2,100 grams. So definitely a little bit on the big side, but still, well within the realm of a normal appearing liver, right?
No need to be addressed.
Exactly. Now, on 9/11/2024 at approximately 1 p.m., a telephone interview was conducted with the local medical examiner. And the medical examiner stated they were initially notified of the patient's death on August 21st. And they were notified that it was an inpatient death from complications from the splenectomy, and that they were informed that the death was not due to trauma, but due to a cyst or a mass, and that we declined jurisdiction. So they initially were like, oh, okay, well, if what you're saying is true, then he died of what sounds like natural causes and unfortunate complications of having this mass. But then the autopsy happened and everything changed, right? So the autopsy confirmed that he did not have a liver and that the liver was perfectly dissected off the diaphragm. And, quote, as a forensic pathologist, that is one of the hardest things to learn to do. Essentially, the liver was autopsied out of that man.
Jeez.
That is what the pathologist is saying. Because she takes organs out to weigh them individually and dissect them all the time. And she's like, this is not an easy thing to do on a dead guy unsafely. You're trying to do it safely.
And I'm trying to do it without trying to
kill a guy.
She doesn't have that.
She doesn't have to worry about that. Exactly. So she also again reiterated there was no evidence of any cross clamping. There were no sutures. There was no evidence of cautery being used on any of those bleeding vessels. And the inferior vena cava, that major vein that brings oxygen-poor blood from the lower body back to the heart, was clearly dissected or torn during the surgery. Everything surrounding this liver was completely untouched. The spleen showed no evidence of aneurysm, no rupture, and no evidence that the spleen was even touched or mobilized at all. The spleen stayed where it was born to be, The spleen was 420 grams total, and there was no evidence it was touched or even looked at. This is all from the pathologist, direct quotes. The medical examiner said that a man's liver is between 1,800 and 2,800 grams. The size of a man's spleen is typically 200 to 350 grams, so significantly smaller. Significantly smaller. A diseased spleen can be bigger, but the ME stated that the biggest she has ever seen was 800 grams. So, I mean, that's the biggest spleen she had ever seen, was 800 grams. And this liver was huge. That should have been number one red flag with this surgeon. And we have some interviews with operating room staff also. So an operating room RN, circulating RN, was interviewed during this investigation. And she stated that she was working another case across the hall and didn't enter the OR to assist until after the time of death. And she entered to help, and the scrub technician and the RN circulator were present, and they asked her to please go get the chief medical officer. And that's why all of the higher-ups started filtering into the room at the end of the case to figure out what was going on. So she was asked to go get the CMO. RN stated that the CMO came into the OR, and that's when the specimen was discussed. The specimen was pulled out of the bucket, and we were all like in shock. Immediately, the CMO contacted the pathologist and had the specimen walked to the lab. People in the room said, quote, "This looks like a liver to me."
Hello?
The RN said, "We were all like, this is definitely not the normal anatomy of a spleen. You can tell between a liver and a spleen." I mean, these people watch surgeries all day, every day.
Yeah.
And it's easy to identify.
Why didn't anyone say anything?
That's what kills me.
Why didn't anyone say
They shouldn't have had to, because this was grossly negligent.
Of course.
Grossly. They shouldn't have had to, but they were put in that position. That is the unfortunate reality. And more action could have been taken. The opportunity was there, I think, at least if what is here is true. So we were all like, this is definitely not the normal anatomy of the spleen. You can tell between a liver and a spleen. Basic knowledge of anatomy, this nurse said. She went on to say that before the code had occurred, she was, quote, being nosy and looked through the OR window. And she said, all I could see was a huge megacolon. I mean, this guy's colon was out.
So she's through the window.
She's not even in the room. And she sees the megacolon. Nobody mentions it in the op report. Nothing about that. And the RN then recounted that after the patient's death, how the surgeon came back into the OR not once, but 3 times to state that the patient suffered a splenic aneurysm. And there was nothing that could be done to save him.
Was he like trying to convince the team that this is what happened?
The team and maybe himself a little bit. Yeah. Just to try to assuage concern.
What the hell?
So he also came back asking for the measurements of the spleen because he had to document that, evidently. And on September 10th of 2024, an interview was conducted with staff member F, is how they're referred to, or an OR scrub tech and the first assistant. And she stated that she was informed by the RN circulator of the patient's abdomen being distended. And because of what case we were doing, we were guessing it was blood pooling. And so this was like before the surgery. They were prepping for the surgery. And they thought that procedurally we would have problems with visualization. So she started collecting the things that she thought she would need for the surgery. And she said that they put trocars. Now, the trocars are these like sort of pointy tube things, and they are the things that go into the abdomen for laparoscopic surgeries that allow for access of the tools and the camera. So they create that little hole, a sheath for the hole, if you will, for the tools to go in, right? So she's getting the trocars together. And she said they put in the trocars during the surgery, and they saw that there was blood on both sides of the abdomen. She said, but not an insane amount. She didn't think it was anything that would have been unexpected for this scenario, for something that had bled, right?
No alarms
It
yet.
was not an alarming amount. Right away, we noticed how dilated the colon was, and we could see this on the screen. Visualization was very tight because of the colon. And she said the surgeon put in 3 trocars, which is standard. But again, they were not able to see a lot. And the hand port went in. And this is a hand-assisted surgery, classically, which means you put in a bigger port so that you can sneak a hand in there and literally use your hand to bluntly dissect adhesions off the wall of the abdomen to mobilize the organs.
Considered laparoscopic.
Still considered laparoscopic, hand-assisted laparoscopic surgery. So he puts the hand port in, and he puts his hand in and he's like, I don't have any wiggle room. There is no room in here because the colon is so big. It was at that point we bailed on the hand assist and we went open. So that's when they
Okay.
decided to make the incision.
I have no qualms with all of that.
No, this all seems reasonable, right? As soon as the surgeon made the abdominal decision, the bowel is spilling out, like bloop, out of the abdomen.
I could breathe.
Yes. And she said to the surgeon that it looked like a megacolon, in which the surgeon A replied that he thinks it was a volvulus of the colon. Now, a volvulus is when the colon twists around the tissue that holds it in place, and it can create a loss of blood or a loss of blood flow to parts of the colon. And that can be a surgical emergency in and of itself. So she indicated that the surgeon is dissecting. She is retracting with one hand and suctioning with the other. So she's like holding back a little bit of the bowel to try to be able to see and try to allow him to see, and also has the suction Yankauer to help clear the field as much as she can. So she's retracting with one hand and she's still holding back bowel with the other. And another staff member, another RN, came in to assist with retracting. And then a third scrub tech was added too. So now there are 3 scrub techs, all hands on for this procedure that is getting complicated. So the surgeon's dissecting. Bleeding happens very quickly and it fills the whole surgical field. And she recalls the surgeon stating that there was a tear in the spleen. Bleeding increased a bit, and we asked for a second cell saver. Now, a cell saver is a device that is often used in the OR in like massive trauma situations where a lot of blood loss has been sustained, or really complicated surgeries like this, where there's a lot of blood that is being lost. What it does is it collects the blood from the patient during the surgery, it spins it, and clarifies it and transfuses it back into the patient. So you don't have to transfuse units of donated blood. It's amazing.
I love that.
But they often need to use 2 or 3 of them in these scenarios to keep up with that amount of blood loss. So the surgeon is asking for the stapler of vascular load, which is that stapler device that I described that looks kind of like a Nerf gun, big plastic thing with a load that is supposed to cauterize. And after the first staple is when we got into horrible bleeding, is what she's saying. Once into the bleed, there was no going back, and we never had visualization of the field again. There was no specimen at that time, just dissection. CPR was initiated, and the surgeon started to continued to work during compressions. She recalled stepping aside and seeing with both hands Surgeon A take the specimen out and lay it on a drape. All the techs, we immediately noticed that doesn't look like a spleen, number 1. And number 2, it was massive compared to what you thought the spleen was going to look like. Like, that is, whatever that is huge. That ain't no spleen. Like, there's no way in hell that is a spleen. Now, Scrub Tech F then stated that at one point, a different surgeon comes in. He asks what happened. She thinks that she told him at the time, like, I'm not really sure what's going on. We're getting a lot of bleeding. A specimen just came off the field, but she couldn't answer any of his direct questions. She was trying to keep it together and try to focus on what was happening here and trying to help. So the scrub tech and the surgeon kind of go around to the back table and they look at the specimen together. And the surgeon that had entered to help said to the tech, "That looks like a liver to me." In which the surgeon that was still operating, Dr. Shaknovsky, replied, "Nope, that's a spleen." "You're incorrect."
That's not true.
So, the scrub tech then stated she and the RN were talking amongst themselves, that the specimen looked like a liver. She stated on the underside of the liver, it looked like there's that little concave space where the gallbladder had been, like it had its little tuck-in spot. She asked the CRNA, who's a certified registered neuroanesthetist, they often help in surgeries, and if the patient had a previous cholecystectomy, and she was told yes. And when the chief medical officer was asked to come into the OR, we asked if this was a safe place to talk, and he replied yes. And we told him none of us think that what he took out was a spleen. We think it was a liver. That's what they said to the CMO when he walked into the OR. She remembers that Dr. Shaknovsky was asking for another stapler with a vascular load, and then asked for another cell saver and suction, and then asked for 3 more stapler loads, which is a lot. And again, he's not asking for clamps. He's not asking for ligation. He's not asking for cautery. He's asking for the stapler. And she recalls while doing a staple load, he reached out with the Kelly clamp multiple times, she indicated. And shoot, sorry. It just screamed way far off. Okay, here we go. She indicated that when she reached out with a Kelly clamp multiple times, which is a hemostat, like a little clamp that would clamp off a blood vessel. That's what they're for. And she indicated when trying to achieve hemostasis, you clamp and then you do the cutting. And Dr. Shaknovsky, never took the clamp from her. Never took a clamp at all. So Scrub Tech is stating at this point.
It's like, no, he never.
Yeah.
Yeah, he never asked for
exactly. And this is the point where they start coding the patient and compressions are ongoing. She recalls that when she began compressions during her 2 minutes, the specimen came out like while she was on the chest doing compressions. And that's when she saw the liver on the table. And that's why she thought, why is he doing that? She said, I saw 3 lobes, and I saw like the little concave space where the gallbladder. She's like, why is his liver out of his body? What the fuck are you doing? So she stated that everybody kind of looked at each other and everybody knew it was a liver at that moment.
This is messed up.
Mm-hmm. They asked the CMO once he arrived to look at the specimen. And again, that's when he looked at the specimen and turned back around with his eyes wide. And he said to get it to the pathology department now.
Even though they all knew they needed that confirmation.
Well, they did. They did need
knew,
the confirmation, right? Subsequently, again, on September 11th of 2024, a telephone interview was conducted with another staff member, another RN circulator, who stated that the surgeon had started the case laparoscopically, noticed some blood in the abdomen and the megacolon, which made it difficult to view, and that they were going to open up the incision. And she noticed that the patient's abdomen was distended, and we opened at the time. We're moving the colon around to get out of the wound and some suctioning with some blood, which was minimal. She said there was minimal hemoperineum in there. So, and the surgeon immediately asked for that GIA stapler again. And she said, normally when you're working on the spleen, you identify and you clamp the splenic artery and vein. That is a big step in the surgery. And she said she didn't have a good view because of the megacolon in the way. The surgeon was the one looking down into the abdomen. She says he fired the first staple, then asked for 3 more loads. And then the patient hemorrhaged, like, immediately. So he's, like, even if this was a spleen, I don't know that this would have gone well. Right?
No.
Like you said.
Like I said.
Like you said.
It was all just sloppy. Yeah.
If it was all just sloppy, he was not following, like, the proper procedural steps. She had stated, quote, my first thought was that he didn't have control of the splenic artery and vein or of the hemorrhage itself. She said once the code was called and we were busy dealing with the hemorrhage, helping anesthesia, hanging blood, things like that. During this time, I saw the specimen on the table. She stated, it looked like a liver and I felt sick to my stomach. I knew if he took part of the liver, we weren't going to be able to stop the bleeding. She asked the surgeon to identify the specimen. She stated that she is instructed to write down what the surgeon says and that he said spleen, the spleen. I thought, excuse me? And the surgeon insisted that that's what it is, and that's what I labeled it as, because he's the one that took it out. Which this part I understand. I mean, I know that you look at it and it's obviously a liver, but I mean, we're going to figure out what it is at the end of the day through pathology. Dude, if you want me to label it as spleen, like, okay, you know?
But I'll change that.
But I know it's liver, okay? She said, I knew in my heart it was the liver. And the surgeon stated to them, you guys realize the patient died because he had a splenic aneurysm, right? And she said, quote, we just looked at him and didn't respond. So when he walked out of the room, we looked at each other and agreed that it looks like a liver. She described that the spleen was smaller and with like sort of rough surface. Like a liver is very smooth. At least a healthy liver is very smooth, very shiny. A spleen is like bumpy. There are obvious texture, weight, size differences that are very obvious. The liver is usually like purplish, smooth. The spleen is an entirely different color. It's just like wild that none of this was a red flag.
Different.
So different.
It's not
I
like,
cannot stress enough how different
like
these organs
they're
are, okay?
Identical twins.
No, they are not. This is not an easy mistake to make. So an assisting anesthetist who was present stated that the patient became immediately hypotensive when he started to hemorrhage and he was about to code. And that the staff then stated that the patient is coding and begin CPR. And the RN then said, I immediately started chest compressions while the nurse called the code blue. And the RN reported that the surgeon took out the liver and replaced the patient's, and he placed it on the patient's legs and stated, I put it on the table. Then the CMO was in the room, and we looked at the specimen and told him it was the liver, and he needed to look at it. And she said the CMO looked at the specimen and said he was calling the pathologist. So it's interesting that all of these stories from all of these different staff members are exactly the same.
Except for one.
Except for one guy who's telling a very different story. You're seeing that all of these staff members are separately telling the exact same sequence of events. So she then again testified that he came back in the room 3 total times, telling us that the patient had a splenic artery rupture and that's why he died. And then when things were going downhill, a second surgeon was called in to assist. And this is a staff surgeon, not one of the higher ups. He was called in to scrub into the surgery and assist, right? So he was interviewed also, another general surgeon, and he had stated, quote, "I received a stat request to come in to assist. I was in the medical office building across the street, but I came right over. Compressions were already in place.
Mm-hmm.
The CMO was running the code. Then he called the code about 10 seconds later. And the surgeon stated that he observed the organ on the back table, and he stated, quote, "I didn't say anything. Dr. Shaknovsky made a comment and identified it as a spleen. I gave him the eye, and I walked away." I mean, at that point, what's done, it's done.
Correct.
You know what I mean?
Like, there's nothing.
The guys can't get much deader than he already is.
Nope.
There is so many more accounts, and they are all exactly the same. This is how that whole thing happened.
I mean, I'm just saying there's one outlier here.
Yeah. And his name is Dr. Shaknovsky.
I like your pronunciation.
Thank you. I've been working on it. I cannot even imagine the whoomp I would feel being in that room and watching a liver being lifted out of this man.
Could you imagine? No, I can't.
I would never recover. It's, again, a liver is so unmistakable.
Can you imagine being that CMO?
No.
And he walks in there and he looks in that bowl.
And he's like,
and he's just like,
well,
looking around.
Well, I better get my affairs in order.
Yeah.
So should all of you. Oh, the medical examiner's office is initially handling this investigation. Their findings are pointing to such egregious error that the case was forwarded to the Walton County Sheriff's Office, who later told People magazine, "Our duty is to follow the facts wherever they lead, without fear of favor." Walton County Sheriff Michael Atkinson said in a statement, quote, "The grand jury has spoken, and our responsibility is to ensure the charges are carried out through the proper legal processes, and our thoughts remain with the victim's family and their unspeakable loss." He then added, "We are committed to seeing this case through with professionalism and integrity, as our community expects." So, Ascension Sacred Heart Emerald Coast Hospital previously told People in a statement, quote, "We take allegations like this very seriously, and our leadership team is performing a thorough investigation into this event." And then, once the charges were filed and the indictment came out, they kind of had a follow-up statement that essentially said, "We take privacy very seriously, so we're not going to comment on anything."
You weren't going to comment anyway.
Because of the privacy, right?
Uh-huh.
Yeah, that makes sense. So, ultimately, the second-degree manslaughter charges were filed. And on Monday, April 13th, just last week, he was taken into custody and booked to the Miramar County Jail. He did post bond, and on April 14th, the following day, he was released to the tune of $75,000, and he is scheduled for his next court date on May 19th, 2026. And ho boy, are we going to follow the shit out of this one.
Oh, we sure will be.
Yep. Now, according to WHNT News 19, his wife Beverly has stated, quote, "I have never talked to anybody that wasn't shocked and just appalled and couldn't understand how in the world it would happen."
So how did she finally find out that it wasn't the spleen?
They had
medical examiner,
to,
like they could give her the autopsy reports. Like you said, it was at least 3 days.
it
before
was
she
several
found it.
days, and I
Yeah.
think it was actually longer than that. And it was hell on earth just for the medical examiner's office to get the information that they needed out of the risk management department at the hospital. And I think it was once the autopsy came forward that she found out, definitively what happened, which is so horrifying. So horrifying. So she then went on to state, "It has devastated my family." She said that there hasn't been a moment that has gone by since that dark August 2024 day that she hasn't thought of her husband. There were so many things that he's missed. He missed his grandson's graduation, Oh, just so many things, she said. Every day I miss him all day long. They don't have a
heartbreaking.
GoFundMe or a donation page that I could find. I kind of scoured looking for one. If anybody out there knows of any sort of donation or anything, please shoot us a message and we'll share it on our socials. But I couldn't find anything.
There might have been one in 2024.
There might have been one a while ago, and maybe it has closed since then. I'm not sure. But otherwise, of course, I will share if somebody can find something. But if you want to keep following the story, all of their local news outlets and all of our national outlets are all over this like white on rice.
Indicted by the grand jury that they're going to proceed to trial.
Yes. So
now it's going to happen in May.
May 19th is his first trial date. We'll see what comes out of that, and we will keep you updated. Yes.
Well, I can't believe that.
Yep.
Thank you for listening, everybody, to this insane two-parter. What a headline, first of all.
I know, dude, right? Woo!
You can find us on Facebook at MedCrimes Podcast.
You can find us on YouTube by searching MedCrimes Podcast.
Check us out on Instagram at MedCrimes Podcast.
If you want to become a Patreon, you can find us at www.patreon.com/MedCrimesPodcast. I just went real weird with that voice.
Slur.
Holy Toledo. Time to go to bed.
You can send us any crazy stories, ideas, suggestions. Say hi at medcrimes@gmail.com.
Know your right from your left, just in general.
Saying it.
Did you know that if you hold up your left hand,
it makes an L?
It makes an L. And if you're a general surgeon,
you need to have that.
That's important. Sometimes my 7-year-old son doesn't always know his right from left, but that's okay because he's a 7-year-old and not a general surgeon.
Correct. All of that is factual.
Okay. And not alleged.
Goodbye.
Bye.